Dr. Guleria, while the vaccine is one part of it, treatment is another very, very important part of it. And one of the things we've noticed, and I want your opinion on whether you think this is true or not, is that the data seems to show that most countries have got progressively better at saving lives as the pandemic has gone, right? I mean, in the initial period of the pandemic, the death rate was very, very high. And then over a period of time, at least purely from the data point of view, it seemed as if the progressive death fatality rates were coming down. Do you think that over a period of time, health systems, doctors figured out what to do to save lives?
Definitely. I think as we started off with the pandemic, somewhere in February, March, even in our hospital, there was very little we knew how to manage patients with COVID-19. And a lot of it was done on whatever data was emerging from China. And we were using anti-HIV drugs like lopinavir, ritonavir. There were a lot of other drugs which were being used. And gradually we had more and more data which showed that they were not of much use. We were reluctant to use steroids because the data from H1N1 pandemic and analysis there actually had tried to show that you had a higher mortality if you gave steroids, especially during the early stage when there was viremia. So all of this evolved, and we then realized that, steroids are useful. They really save lives based on the recovery trial. The utility of remdesivir, which has gone from one end to the other, established itself. We also had the use of a lot of other indigenous drugs, which I still would say we need more data in. But we are getting studies coming in, whether it be drugs like ivermectin, the debate on hydroxychloroquine, or the new drug, the drug that we use in India, which has also got a license from the drug controller, favipiravir, which is basically an antiviral for influenza, but has been shown to have broad antiviral effect against even Ebola and other viruses. Also, I think our management strategies improved. We realized that oxygen makes a huge difference, and we have people who may be hypoxemic, but they don't realize it, so-called happy hypoxia. And that even conscious proning, that if you just ask these patients to lie on their stomach or this side, will help in terms of improving oxygenation. So I think over the last few months, whether it be managing sick patients who have sepsis or ARDS, managing moderate patients, or developing a treatment strategy, or placing these drugs in the right time, because there was a time when I remember talking to doctors in India, and they would give a cocktail of all drugs in the beginning, feeling that something will work. But we realize that that's not true. You may have some drugs which may cause more harm, especially if you're giving anti-IL-6 drugs very early, and they can actually lead to superadded infection. So our protocols have evolved, and that has led to a decrease in mortality. We've also been able to pick up warning signs and be able to get people inside hospital early and manage them. But having said that, we still have a significant mortality, and I think it's important, especially the elderly and those who have comorbidities, be monitored closely. It's somehow because of what I would call as COVID fatigue. We're seeing a lot of people not following the general precautions that we keep advising, and many of the young individuals who go out, get the infection, carry it to their homes, where the elderly get the infection, and this can also contribute to a higher morbidity and mortality. So I think it would be very sad for someone to lose an individual now when the vaccine is just around the corner. And it's very important for people to understand that if we hold on for just a few more months, then we could actually save a large number of lives, especially of the elderly and those with comorbidities, because the vaccine will protect them. And that is what these two trials have shown. And that is why it's need to really sort of emphasize more strongly that COVID appropriate behavior is more important now than ever before, because there is light at the end of the tunnel. So you can't say you don't know when this will get over. We know that it will now start getting over sometime next year.